maybe you can help me with this, is they'll come in asking for contraception, as Christine said, usually the pill, and I'll start talking about the other options, but I find they're not there. They're shutting me down. They're not listening. They want the pill, and I would like to talk about an IUD, IUS. I'd like to talk about next plan, and there's other options. There's rings. So how do you approach that when you know their focus is they want a pill because that's what they know?
For sure. I think that's changing. But when you tell them that like 50% of OCP users discontinue after 12 months, and if they want contraception for longer than that period, I find the SOGC counseling table where they can actually see the options and see typical use. So we don't ever look at the perfect use because we don't live in controlled trials. And they can see the rates of pregnancy with the option that they're thinking about. But I find like the health-seeking patient who's coming in before their sexual debut is quite rare. So I'll see patients after an unplanned pregnancy. So they're very motivated for a highly effective form of contraception. And we also know that we're using LARCs off-label in patients that are under 18, but telling them the SOGC and the Canadian Pediatric Society really support that practice. And sometimes it's showing them a tactile example so they can see what it looks like, explain the procedure. And, that's a counseling appointment, bringing them back when they're ready, but of course, giving them a pill. So the 30 milligrams of ethinyl estradiol or the estetrol pill is a great option in the interim, but they tend not to continue with those.